name's Ashwin, Bhadresha, one of the core surgical trainees at William Harvey Hospital in Ashford. My presentation is on Charcot-Marie-Tooth disease as a risk factor for periprosthetic fractures in Tibiotalocalcaneal fusion with intramedullary nailing. So Charcot-Marie-Tooth disease is the most common inherited demyelinating neuropathy. It affects approximately 1 in 2,500 people. Now, the neuropathy and muscle weakness in the lower limbs develops over time to become rigid and severe. These foot deformities and associated neuropathy can lead to chronic ulceration and osteomyelitis, which may then require a limb amputation. Now, tibiotalocalcaneal fusion arthrodesis using an intramedullary nail is often the only alternative to limb amputation, because the deformity is often too severe to have joint preserving operations. Now, in our cohort, we noticed a disproportionate rate of periprosthetic fractures in these Charcot-Marie-Tooth disease patients following tibiotalocalcaneal arthrodesis with retrograde hindfoot nailing. And so therefore, our hypothesis was to test this. So we conducted a retrospective review of patients who had TTC arthrodesis with intramedullary nailing over a 7-year period. And our exclusion criteria were essentially traumatic osteoporotic ankle fractures and revision cases. All patients had radiological evidence of severe arthritis of the ankle and subtalar joints, and they had failed conservative treatment. Moving on to the results. So we had 45 patients in our cohort. 41 patients achieved radiological and clinical fusion of their TTC arthrodesis. We had 3 patients who had Charcot-Marie-Tooth disease, and all 3 of these patients sustained a periprosthetic fracture. This was at the tip of the nail, and this was roughly 4 months after the index operation. And basically, the nail position of these patients was central in both planes, AP and lateral. Now, in comparison, no patients who didn't have Charcot-Marie-Tooth disease, none of those patients sustained a periprosthetic fracture. So this is the first Charcot-Marie-Tooth disease patient. This is a preoperative X-ray. As you can see, it shows severe carbovarus osteoarthritis of the hindfoot. Now, this is a post-operative X-ray of that patient, showing the hindfoot nail, which is central in alignment on both the AP and lateral views. And this is the periprosthetic fracture that the first Charcot-Marie-Tooth disease patient sustained. And that occurred after just a simple twisting injury. This is the second Charcot-Marie-Tooth disease patient who sustained this periprosthetic fracture, which was sustained after he lightly knocked his leg against a wardrobe. Finally, this is the third Charcot-Marie-Tooth disease patient showing a displaced periprosthetic fracture, and there was no history of trauma in that particular patient. So, in conclusion, we noticed a disproportionate rate of periprosthetic fractures in Charcot-Marie-Tooth disease patients undergoing tibiotalocalcaneal arthrodesis with intramedullary nailing. The likely reason is because in patients with Charcot-Marie-Tooth disease, there's impaired function of the peripheral nerves, resulting in sensory and motor neuropathy with loss of protective sensation and muscular atrophy. This could lead to repetitive microtrauma, which causes fractures, even though 2 of the patients in our cohort had no history of trauma. Therefore, this confers that Charcot-Marie-Tooth disease is indeed a significant risk factor. Now, to prevent this phenomena from occurring, we propose to use a longer nail to reduce the lever arm with a long period of protected weight bearing till union, followed by elective removal of the nail. Thank you very much for listening.